so that he will let us send forward the slide to us to me to access. Okay, he's here to join. Bang Sydney is also here to join.
I'm in class, yes.
Okay, are you ready now?
Yes, but someone is sharing already. So maybe I can go after him.
Okay, so let that person share.
One has shared the screen already, so I will take after him.
Okay, so this is Banwan Guma John.
Yes, sir.
Okay, that's lovely. That is lovely. Yes, so please continue. You have 3 minutes.
Good afternoon. Good afternoon, sir. Good afternoon, my fellow colleagues. I'm Bamu and on how to identify waterborne disease affecting my community. Any waterborne disease in the community. We have the key signs: sudden rise in diarrhea, vomiting, linked to some water source.
I drop you. I will follow like this. I'll just drop you for junction. They go.
I have the environmental monitoring, water testing for pathogens, E. coli, Salmonella Gardea, inspect wells, boreholes, tanks for sewage/runoff. Watch for usual odor, test and turbidity. Method used: water quality testing, testing of coliforms, E. coli, chorea bacteria, assess chemical contaminants, community health surveillance, and track diarrhea/fever outbreak. Collect clinic and household reports. Then environmental observation, inspect water source for contamination, assess sanitation and hygiene practice, collaborations with Ministry of Health, WHO, UNICEF, use wash hand indicator to measure this my size. To measure. Thanks for listening.
Please share the slide again. Wait, leave it. Wait now. Wait, you are too fast. Just a minute. Just a minute before the next person comes up, but let me put up because where I am now, electricity just went off.
Okay.
So this is ban. Wait, who you are presented now?
That was one.
Yes, ban one. Ban who?
Bamboo and Guma John.
Okay. Guma. Okay, thank you. So the next presenter.
Okay, let me share my screen.
We are listening to you. Please continue.
Yeah, I'm trying to share my screen. Please confirm when you see it.
Yes, we have seen your screen.
Okay. Okay, so my name is Sydney Van. Waterborne disease in our community. So the first step normally is through environment by monitoring local reports, collaborating with health providers, and tracking disease pattern. Symptoms, malaria, vomiting, abdominal pains, fever. Then you suspect that there might be outbreak in any of the waterborne diseases. Then you get the outbreak by defining specimens, conducting epidemiological studies, and determining sources of contamination. And the only way you can prove for sure that this is happening is when you test water quality to know whether the water is contaminated. You test for pathogens like E. coli and Vibrio cholerae. Treatment processes, you check for sanitation practices. Thank you. Thank you for listening.
Okay. Thank you so much for that presentation. Any other person that's ready?
Thank you.
Thank you. Any other person that's ready? Yes. Anybody ready? Anybody that's ready? Bangma, thank you. So can you mute your mic?
All right, sir.
Please mute your mic. Thank you. So any other presenter? Olawumi is yet to join. He had challenged in the morning. And Olawumi, are you there? Can you? Olawumi is yet to join. Maybe he's experiencing network challenge. Or he's still on break. Can anybody contact Olawumi so that we know his challenge, whether we can wait for him or we can proceed? So the fact that maybe one is having network in one place does not mean that another person is not having challenge. So it's good to please, Kenu, can you mute your mic? Thank you. Okay, let us give them 5 more minutes. We
ใช่
Can anyone hear me?
Can hear you.
Yes, we can hear you, sir.
I can hear you.
Yeah, with you, sir. Can anyone
Oche, we can see your screen now. Go ahead now.
Now when you're supposed to attach the document. I think we'll close them first. Are you sure you're not supposed to close it? Hello? Hello?
We can hear you.
Hello, we
Okay,
can hear
good
you.
afternoon. Good afternoon, Malaysia. Good afternoon, my classmates. Can you
Good
see my
afternoon.
slide?
We can
Can you
see
see
your
my
slide. Go ahead.
Okay. My name is Ikenon Philip Teyima, presenting how I can identify waterborne disease in my community. Introduction. Waterborne disease are illness caused by pathogenic microorganisms that can be transmitted through contaminated water, leading to various health issues, including gastrointestinal and respiratory illness. I can identify waterborne disease through community health observations by monitoring common symptoms in the community, e.g., vomiting, fever, dehydration, stomach pain. Second, by tracking disease patterns, such as sudden increase of increase of similar symptoms. Third, engaging local health facilities by checking reports of typhoid, dysentery, and hepatitis. Fourth, interviewing community members, asking about water source use before falling sick. I also identify waterborne disease through environmental assessments. This can be done by inspecting water sources, clouding, smelling, cloud water wells without covers, clogged borehole, and dirty surrounding. Second, the second way I can I can assess the waterborne disease in my community is by checking contamination risk, open designification nearby. Thirdly is by conducting a simple water test, turbidity, pH, chlorine residue, coliform bacteria. And the last one is by mapping water source and illness cases. This can be done by clustered around one water source indicates contaminations. Thank you all. Hello?
Yes, we've heard
Hello?
you.
Thank you,
Yes, we
kid.
can hear you.
Hello? Hello? Hello?
We can hear you.
Oche, we can hear you.
Class rep, can I present?
Yes, you can go ahead.
My concern is that my slide is up to 6, so I don't know. When I tried to type, I got up to 6 slides. So.
And share
Hello?
it. Now that is what you have.
Mine too was up to 6. Go ahead, please.
Because all the research I made, God gave me 6. I don't know. So can I share now? I can go ahead, ba?
Go ahead now.
Go ahead and share, Oche. Go ahead.
Oche, go ahead. Time is not on your side. Go ahead.
Okay.
Simon, continue.
Can you see it now?
Go
Can
ahead.
you see it? Hello? Okay, my topic is identifying waterborne disease.
Oche, we can't see your screen. Oche, there's nothing. You are showing us this thing. We can't see your screen.
You're showing your desktop background.
Can people hear me?
We can hear you, but can't see your slide.
Hello?
Who else is ready to present? Anybody that is ready to present, share and start presenting.
Um, oh, oh, yes, Olufemi. So Olawomi, you are still experiencing difficulty in sharing your slide.
Yes, I will share it now. Can you see it now?
Huh?
Can you see my slide now? I'll share it.
Yes. Go ahead. You can see
Okay,
it.
yes, you can see it now. That is good. Well done. Well done. Okay, continue.
Thank you, sir. Good
Yeah,
afternoon,
tried.
good afternoon, my colleague in
Yes.
the house.
Good afternoon.
My name is Olawuni Blessing Peter. I want to talk about on the topic as an environmentalist. How can you identify waterborne disease affecting my community? Firstly, I would like to define what waterborne disease is. A waterborne disease is an infection disease that is transmitted through the injection and the contact with water contaminated by pathogenic microorganisms. So I would like to talk on my slide here, which says identification of waterborne disease. Can you hear me?
Yes, we're hearing you.
We can hear.
I would like to talk on my slide here, which says identification of waterborne disease. The surveillance via the IDSR, which is known as the Integration Disease Surveillance and Response, and we have the NCDC, which is known as the Nigeria Center for Disease Control. They are to detect, survey, and report any analysis and response to priority of the disease. And the second one, which says the review of cholera, typhoid, and hepatitis A and E, which is any cases cluster is a systematic and investigation conducted when two or more cases of disease occur within a short period of time. So, and the following one, which it says the GIS mapping of affected wells and borehole, the geographic information system, which is the GIS mapping, is to use to analyze tools to identify and visualize and analyze the distribution of contaminated wells and borehole in relation to disease occurrence. So those are the ways by which, as an environmentalist, can identify waterborne disease which is affecting my area, And the last one which I have on the list is to focus on the small children, the little children under
You
the
you
age of
have 1 minute.
Okay.
You have one.
Okay. I will conclude very soon. Under the age of 5. So the children under the age of 5 years in oral population should have the high risk to this waterborne disease because of the level of their of the control of the immune system in the small children. So they can be the first person to be identified of waterborne disease. So let me conclude. In conclusion, a strong surveillance system should be put in place. Early detection of case cluster before it will escalate, before it will spread. And there should be geo information system to contaminate well and boreholes. And there should be post-flood outbreak investigation. There should be laboratory confirmation of pathogen. Thank you very much.
Thank you so much for the presentation. Any other presenter? Hello, can you all hear me?
Yes, can I present, sir?
Huh?
Can I present, sir? Oche Simon.
Yes, present.
Okay, let me try to share. Try to share. Try to share. Then don't carry me go and move.
Please, introduce off, mute your mics. Peter, blessing, mute your mics. Peter, blessing, mute your mic.
Hello, sir. Hello, sir. Please, can you see my screen, sir?
Yes, your screen is showing.
We can see your screen. We can see your screen.
Okay, I'm presenting on identifying waterborne disease in Wadata, Makurdi, Benue State. An environmental health perspective presented by Oche Simon Ode. You can see identifying waterborne disease in the community. Like waterborne disease are infectious infection transmitted through contaminated water containing pathogenic microorganisms such as bacteria, virus, and parasite. Common example could be, we know all these water contaminated ailments like cholera, typhoid fever, dysentery, hepatitis, and giardiasis. Then we have the environmental indicator to monitor as an environmentalist. Identification begins with, in identifying this waterborne disease, we need to know assess environmental risk factors such as poor sanitation, open defecation, contaminated surface water like river, well, but where they're actually contaminated, we know that they can pose some of these risks. Flooding and sewage overflow, inadequate waste disposal system, lack of portable treated water supply, community-based identification method. Then in epidemiological surveillance, we have epidemiological surveillance. Once we know that there's sudden rise in diarrhea, vomiting, and fever, it could be sign of that. Clustering of illnesses, household using same water source, high incidence among children, which are most vulnerable. Most children under 5 years are most vulnerable most times. Water quality testing. Well, to know water quality testing, to know exactly how suitable this water, we need testing. We need to test for fecal coliform bacteria, e.g. E. coli, and then measuring turbidity and pH level, microbial culture and laboratory confirmation. All these can reveal water quality testing to know the portability of water for use. Then we have community health record, review clinics, hospital, and data, comparing seasonal outbreak. Then 3, we have environmental assessment, prevention, and conclusion. Risk assessment framework to identify and control outbreak. 1, we conduct sanitary survey of water source. Always we should know the sanitary state of water source, where we get our water. We need to map the contamination point, identify vulnerable population, and assess hygiene behavior within the household. Then prevention and control measure. How do we prevent and control this menace? 1, by water treatment. How do we treat this water? We can do chlorination, boiling, filtration, protection of water supply source, protection of water supply, public health education campaign, improve sanitation infrastructure, collaboration with public health. I don't know. Then our conclusion. The conclusion, identifying waterborne disease in the community requires an integrated environmental and public health approach. As an environment, my role includes 1, monitoring environmental risk factor, conducting water quality assessment, supporting epidemiological surveillance, promoting sustainable system. Early detection and proactive intervention significantly reduce mobility, mortality, and socio-economic burden. Thanks, sir. Hello, sir.
Well done, Oche.
I don't know. Hold on. Is he there? Dog there?
We're with you. I don't know if he's there, but we're with you.
Actually, I don't know. I was trying to scroll. I don't, but like jump on slide. But the work I did, I got close up to 6 slides. The research I made, but I was able to summarize and just do 3 out of them, like he said. So I don't
well
know.
Done.
Hold on, man. Should I hang on for him? No?
We're all waiting, and once you're done, another person can present. That's all.
Okay. But you can see my slides anyway. I'm scrolling it in case.
Yeah, we saw it.
Okay. So maybe I'll hang on for a while if you can come on. Otherwise, if someone wants to present, you people can test for me now.
Oche, nobody's testing for anybody. We're all waiting for doctor to come and answer us. So for now, you can drop
Okay,
down your slide, let another person present.
okay.
Oluwane Peters, please off your mic. Oluwane Peter Blessing.
Rep. Class rep. Hello,
Yes.
class rep.
Yes. I can hear you, Oche.
I've been able to present note for me. I was able to present you. I hope you take note and get back to him for me. Did you listen to me?
What did you say?
Hello.
I can hear you. What did you say? Hello?
I presented. I want to log out and attend to. I want to pick my children from. Hello, can you hear me? Can you
I
hear
am
me?
not. I'm not in position to give you that that permission. The lecturer in charge should do that.
But did you listen to my presentation? At least as a class rep,
Yes,
you
I
can attest
did.
for me now.
No, I can't attest to you now. You will
Because
attest
I
to
need
yourself.
to. Okay.
Hello, has everybody presented? Hello?
I don't think everybody has presented. It's just for us that I don't. Everybody may not have presented, though. So we don't know. But
I have not presented though.
Then if you are ready, present now. So when he comes back, he will just see your slide and then score you. Or you are not ready to present today.
I just take note of some of us that are presented. Just note our names for him now. Abu Livenus.
Yes.
Just note us that are presented.
He's the one writing names of people that have presented, not the courtroom. Stop putting the courtroom in the right corner. Oche, it is not 2:00. Be patient. Wait.
We need to go and do other things now. Yeah?
If you need to go and do other things, you can go. Nobody is forcing you. Because the class is not yet over. Your class is supposed to finish by 2. This is 1:55. So if you need to go and do other things, you can go at your own distance.
Okay, I'll wait. No problem. I'll wait.
I think he's having some difficulties with his network. If anybody wants to present, go ahead. Like he did the other time when he came, he only asked for this slides of those people who presented.
Okay.
Let me show you 3 best camera settings that will help you.
Marian, we are seeing your slide. We are not hearing you.
Good afternoon, everyone. Oh, Adnan, I said you should go away.
Mira, continue. I was thrown out, but thank God I've joined back. Mira, can you continue,
Sir.
please? Yes.
Hello, sir.
Yes.
Hello, sir.
Yeah, I can hear you.
I've been able to present. You were not online.
Yes.
I don't
Okay,
know.
don't worry. I'll collect the
Or
records.
check time.
Yes.
Or check time on Ode. Whether. Hello.
No problem. Wait now. Wait. Haba. Miriam.
Yes,
Hello,
sir.
Miriam.
Good afternoon, sir.
Yes,
Yes,
continue,
sir. Good
please.
afternoon.
Yes, continue.
As an environmentalist, waterborne diseases are diseases caused by pathogenic microorganisms that are transmitted by water. Clinical symptoms: diarrhea and vomiting are the most commonly reported symptoms of waterborne illnesses. Other symptoms may include nausea, stomach cramps, fever, skin, ear, or eye problems. Environmental inspection: lack of clean water supply, sanitation and hygiene
Move your
(wash).
slide. Move your slide so that we'll be on the same page with you.
Sir, we're on the same page. The environmental inspection: lack of clean water supply, sanitation and hygiene (wash), open defecation, and poor waste management are environmental factors that could lead to waterborne disease. Just like the image here, the sanitary facility and the underground source of water, which is the well, and the distance is not much, so there is possibility of underground contamination of the water they use. Then water sampling, laboratory analysis. The key indicators for laboratory analysis are coliform substances, E. coli, Vibrio chloride, turbidity, and the pH. Prevention: access to clean drinking water and sanitation. Water treatment: at the community level, it could be boiling and chlorination, filtration or sedimentation. Toilet facility should be dug 30 meters away from the underground source of water to avoid contamination. Conclusion: waterborne diseases are caused by lack of clean water, sanitation, and hygiene. Recommendation: environmentalists should conduct periodic water quality tests work with relevant authorities, and actively involve the community in the promotion of public health and safety. Thank you, sir.
Yes, thank you, Miriam, so much for that presentation.
Thank you.
So why Ocho was presenting, my network threw me out. So can Ocho just share his slide for me to see? Not to present, just share the slide. So Miriam, please take down your slide so that Ocho will share his. Thank you.
Thank you, sir.
So Ocho, please share your slide. Okay, next. You are too fast. Okay, next slide. Let me see. The next slide. That's all. Okay, so thank you. Thank you. Okay, I've seen it. I've seen it. Okay, yes. Thank you. So take it down. Yes, please. Any presenter? The network here had to change from Airtel to MTN. Now from MTN, now I'm using Glo. So if we don't have these three networks, you can be effective when it comes to dissemination of information. So I'll just advise you to try to have these three networks, service providers, because if you want to be effective. So any other person that wants to present, or you have all presented? Is there anybody still yet you want to present? Has Akase Yado presented? Hello? Has Akase Yado presented? Akase Yado. What about Joyce on the Yima? I can't hear their response. Class rep.
Sir?
Abu.
Sir?
Yes. Has Akase presented? Yado?
No, sir.
And so is it not ready to present today? Akase Yado?
She has not contacted me, sir.
If some persons will just join and just leave us there to think that they are with us.
What about Joyce Yima? Has she presented?
I don't think so. That's why I even asked her. Joyce Yima. And they're not responding. Joyce Yima and Akase. It's obvious they just joined and left to do other things so that they would think that they are with us. Okay, that is it. Let us try and wrap up. Let's try and wrap up. We are already behind schedule. Okay. Since Akase and Joyce have not owned up, so we don't know their fate, whether they are ready to present or they just joined and left. We can't tell, or it's network connectivity. But since the morning, I've not noticed the participation. Let me be very candid. I've not noticed participation of Akase, nor that of Joyce. So it's possible they joined just for to see and they've gone off. So okay, let me just make this announcement before we go finally. I want to at this juncture appreciate each and every one of you for your resilience, for your contributions, your time and energy, and all your resources you have put in for this wonderful presentation. I am highly immeasurable to what you have done. I'm very grateful. Now, moving forward, I just want to have this give you these remarks. Yes, most of you did a very nice job. Although there are some little areas that you need to improve upon. Now, in the academia, any information you are writing that's not your own, please try and acknowledge those scholars. How don't greet you, belongs to you. So at least they comes to your house and this and they
Hello, are we still on the same page? Or can we leave?
I think this class is over.
Course prep.
Are you sure it's over? Because the lecturer was trying to say something, and the
Yes, and
network was.
We need to learn the habit of
the scene
patience.
is
The
not
man
on the.
you want to go. I understand that it has past the time, but we need to be patient with these people. We are all Nigerians. We suffer bad network, light problem, and we are not patient enough. Please be patient.
Now your name is real, oh. It's good.
No, but sincerely speaking, it's possible he was locked out, and I believe he will come back. Let's be patient with him because he said he has some observations and he's going to talk to us about it. Please,
But
let's
you
be
know that
patient.
we cannot be here all day long. We get
Yes,
children, oh.
because
No, but
if you
everybody is making
support
one or two
supervised
sacrifices.
remaining
Let's be patient with him. The same way he was waiting for us in the morning for those to present, he would have finished all these things in the morning and not be online by this time. But he was patient enough with us till this time. So let's be patient with him, please.
When you come to school and allow school pass through you, what have you learned? Learning is not only to read and write. You allow the school pass through you too.
It's not there.
I hope we are just asking. Nobody is quarreling with anybody, please. We're just asking. So,
I think my suggestion we can our course rep or our class rep can able to get in touch with him. If he has anything, he should just drop for us. I
Yes,
think that will be better. Yes.
that's the best. The class is over. The official time is over. I think we can chat the remaining. We can just do it. The class rep can get us posted.
Anybody who wants to leave should leave. Everything I should be here with my data to get you posted. And you will leave everything class rep will get you posted.
Abu, na soldier you be.
Thank you very much. Nobody is paying. But you people
If
expect
you want to leave, you can leave.
Go if you want to go.
Course rep, you have to be
Don't
patient
be
with
soldier now.
class rep. You have to be
Did I slap
patient with us.
anybody? Oche, you have been disturbing
Hello.
since that you want to leave. Did anybody stop you
Hello.
from leaving? If you want to leave, you can leave.
If I don't go carry my children, I
Hello.
go pay money for the school there.
Hello. Hello. Please, you people we have been trying. So there is no need for us to be talking much. At least if you are having a challenge, you can quietly chat the course rep privately and you will leave. So for those people that can be patient and get the information, we will still share them. We have been doing well. I think it's only today that this thing is coming up, and it's not good of us. We are all adults. Please, let's just be patient. Let's be patient. Anybody that is having a busy schedule now, you can quietly leave. But at the end, we will still share the information together. That's my own take. Thank you so much.
Concept, I think you should try to reach out to Dr. Adi maybe via
You say?
call. Indeed, he's trying to reconnect. So we know we are not just waiting in vain. I said you should try and maybe reach him, normal call, and see if he's trying to connect back. So we know we are not just waiting in vain.
Let me reach out to him.
I just type, just workmanship. So they say please for me, no be say please for me. I will go meet. Why is he doing like this? My own system. That's what I do. Eh? Is it the same way you people charge? Is it person bring system? I think the guy just won't charge me for nothing. That thief guy we talk to you that time. What do you mean name? Yeah, we deal with me, we grow up here. Grow with me. You don't think we are not.
Are we still presenting? Do we still have people that are presenting?
Akpan, we do have people that are supposed to present, but they're not ready to present. For now, the lecturer was addressing us and the network tossed him out. So we're waiting for him to finish his address.
Okay. So let's be patient. I will suggest that we cause a statewide complaint about this network issue in Benue State. If the network provider does not roll out services, we should take an action about that.
I was told that the person is from Akwa Ibom State in Benue State here.
Sorry?
I was told the person is from your state.
The person that does what?
Provide network for Benue State.
No, it's not a person. It is not a person. We have telecommunication companies. The MTN, the Airtel, the Glo. They're supposed to roll out their services in entire Benue State. It is very, very embarrassing that people cannot make use of network facility.
Well, based on the information I have for now, they say it's because of the construction that is going on in Makurdi. They say some of the places there is a wire cut issue. So I think that's
the underground wire.
Yes.
The underground cables is being affected.
Yes, the cable. That's what they said.
Okay. That means it's going to be that same effect.
Permission to leave. I'm leaving this lecture, please. Permit me to leave the lecture. It's 2:30 already. Patience.
They no go.
Permit me to leave this lecture.
I am not your lecturer, neither am I your course rep, so you can't get such information from me.
Okay, class governor, please, I am leaving. It's 2:30 already.
They said anybody that wants to leave is leaving. They did not hold anybody. Just quietly leave if you want to leave at your own detriment. That is all.
Share this your data small with me now.
But just Simon, when you opted for the admission, you know you're supposed to use data.
You have much now. That's why I'm asking for little.
Oje, I thought you would have gone by now.
I'm thinking about that.
All right. While you're still online, keep thinking.
Please, we have to wait because the lecturer will soon be available. So we have to wait.
I have not been able to get across to him. The number is not going. I think his network from his end.
Is the
I'm
that
still trying.
trying to change the SIM card on the phone because he told he kept saying he can change his SIM card when the network tosses him out.
State government did not do proper EIA now. Supposed to do environmental impact assessment for this network provider. This is what we are saying.
That is why you're in school. So people should learn it, and maybe since you're already a environmentalist, you can do it on behalf of the state government.
You pay money and then you are seizing your network, you are kind here, having issues. Very bad. So we'll see you on Monday, please. Happy Valentine to everybody.
Take it to your wife, Okusa. Leave us alone.
I should not wish my mate Valentine. Questions, happy Valentine.
Okusa, I don't need a married man's Valentine. Go and meet your wife.
You need my Valentine. I'm telling you. My advice will be key.
When I'm ready, I'll come and get the advice, but not the vow.
Okay, happy Valentine to my fellow men. My fellow married men. I'm married women.
Hello?
Hello, sir. Hello?
Hello? Can you people hear me?
Yes, we can hear you.
I just got off the line with Doc now. He said he has given recommendations, the same thing the other person taught us, that so many people did their work without reference. Some added pictures, which is an added advantage to them. And then he's going to drop his recommendations on the group that all his 3 networks threw him up. So the last one he was able to use was Glow, which finally took him out. So we should end the class and then he will get back to us through the WhatsApp platform. Thank you.
Okay, thank you, sir.
Thank you, sir.
Thank you, Nevano.
Thank you. So we can call it a day. To have a very nice week. So are we going to be able to have our revision on Sunday, or we should leave it next week? Because everybody has gone. We are just 10 here.
I think at this point we'll have to have a forum maybe on Monday. Then we'll decide when we'll start the revision.
Okay. It's okay. Thank you, guys. I hope that's okay.
So have a nice weekend.
Thank you, sir.
All right. Thank you, Livinus. Thank you.
Have a nice weekend, everyone.
All
Bye.
right.
Okay,
Have a
bye-bye.
wonderful weekend and other fellow students.
Yes, sir.
Living, well done for your effort. Thank you so
Thank
much.
you. Thank you. Happy weekend.
Let me end the class. Đang rồi. Pin nó host bên đó. Đang nó